at this new wave of COVID-19, everybody's starting to get anxious. Let's just walk out of the house for 2 minutes, come back, and start thinking whether you get infected yet, whether you are a high risk group or a low risk group, or when you should get COVID-19 tested and what should you do if you test positive. So today we have accumulated some information for you. So with the number of COVID-19 cases in Thailand rising on daily basis, many people worrying about whether they have contracted the virus. While health authorities are encouraging people at risk of catching COVID-19 to get tested, they are also trying to allay fears by providing more information on exactly who is at risk. So who is at high risk? Who is at low risk? The Director General of the Disease Control Department, Dr. Opat Karnkawinpong, recently said that anybody who has been within close proximity of a confirmed COVID patient should get tested immediately. People at high risk are those who, the highest risk are those who live in the same house as the patient and were in close contact when the patient was developing symptoms. Medical workers who handle a patient or their specimen while not wearing protective gear, and patients sharing a room with someone who has tested positive. Also, a high risk are people who have met symptomatic COVID-19 patients and may have been exposed to their body fluids, including via coughing and sneezing. Standing a meter away from a confirmed COVID patient without a mask for more than 5 minutes, or sitting a couple of rows from the patient on an aircraft or bus also carries high risk. He explained that Dr. Opak explained that being in a badly ventilated room with a patient without a mask for 15 minutes is also risky. Working or studying in the same room as a confirmed patient is less risky provided everybody wears a mask and is not exposed to bodily fluids. So, just to give you a simple conclusion, if you wear a mask, your risk is smaller. Mask and keep your hands clean. So, what should those at risk do? People at high risk are advised to immediately seek a lab test and then quarantine themselves at a medical facility or at their own home. However, they cannot walk free even if the first lab test does not detect the presence of the virus. A negative result on the first day only means that the people they came in contact with before the test are safe. They should keep a mask on at all times and isolate themselves for 14 days. During isolation, they may be required to undergo tests a few more times. State hospitals are providing free COVID-19 tests for people who are at risk, though private hospitals are charging a fee. It's between 3,000 to 7,000 baht. However, the National Health Security Office has started covering costs of COVID tests at private medical facilities for high-risk cases. People at low risk are still recommended to isolate themselves for 14 days, during which time they can run their daily errands, provided they stay away from crowded places. People who have tested positive for COVID-19 should contact health authorities. You can use hotline. There are three of them: 1330, 1668, or 1669, and have their national ID and test results ready. They must wear a face mask, isolate themselves, and avoid leaving home while waiting to be admitted to the hospital. So, like the Dr. Opas said, that even though you test negative on the first test and you are a high risk group, doesn't mean that you're going to test negative on the next test. Some people test positive after 14 days of quarantine, after being in contact. So sometimes the germs need a little more time to develop itself to be able to detect on test.